The traditional step is of course to cut down your food intake and increase your activity level. But to be fair, I've seen a lot of people who are actually doing all those things and still they find that the weight is climbing. These are the people that often come looking for a serious solution, including options like bariatric surgery. So I've been a bariatric surgeon for more than 10 years and I've performed different types of bariatric surgery. In fact, when I trained more than a decade ago, we were doing gastric bypass surgery as the standard treatment to help people to lose weight. But over the years, people have moved towards gastric sleeve surgery, where the stomach is stapled and reduced in size without having to do a bypass, because the results are actually very good just from this procedure alone. Right now, what we have is an endoscopic tool where we don't need to do an operation, but we could mimic the results of gastric sleeve surgery purely by stitching the stomach during an endoscopy without having to do any surgical procedure. So the advantage of endoscopy is that patients don't need to be admitted to hospital. All they need to do is to come in the morning, fasted, and we can do a procedure. It's usually done under general anesthetic so that the patient is comfortable. An endoscopy is done and stitches are placed in the stomach in order to tighten the stomach so that it won't stretch as much when you eat. Now, usually 4 to 6 stitches are placed in the stomach, and that is enough to reduce the stomach roughly by 50% in volume. After the ESG procedure is done, the patient will be monitored for the next 2 to 3 hours in the recovery area, and once fully awake and able to drink some fluids, they'll be able to go home the same day. Most people will then come back to the clinic in 2 or 3 days time for a review, after which they will be able to return to work. The advantage of this is that there is really very little downtime. At home they can rest for a day or two and be back to work within a week. This is very different from surgery, when people have to come into hospital to do a surgery, usually stay overnight, and they need a downtime of about 1 to 2 weeks in order to recover, and it takes really about 2 to 3 months before they fully recover from surgery. So endoscopy is a much safer, much quicker option in order to help someone to restrict the amount of food that they eat at meal times.